So my journey began over 20 years ago. I worked extensively in the field of financial inclusion, and I've built large institutions that provide financial services to the poor. But something always bothered me, seeing people, many of our customers, take out high-interest loans for their health emergencies. They were already struggling, and now they had to repay loans at 24 to 28% interest, even when their ability to work was affected. I just couldn't shake the feeling that what we were treating was just a symptom and not the disease. People were going into debt just to keep themselves and their loved ones alive. Health crises were inevitably pushing families into debt traps, sometimes even leading them into bankruptcy. Around the same time, I had the opportunity to work closely with a health tech company, and I was simply amazed at the innovations in early detection and diagnosis. But it was fairly disheartening that on the one hand, you had all these incredible technologies that could be life-saving, but they remained unutilized and we could not take it out to the communities where the need was high. So these experiences led me to a realization that the real impact would come from supporting people through their entire health journey and not just point technology solution. It was then that the idea for Dvara Health Finance began to really take shape in my mind. What if we could create a service that not only provided financial solutions for health, but also supported people through their entire health journey? What if we could keep them out of hospital and healthy in their own homes? Out of this need, NEEM was born. With NEEM, we've created a health subscription service for the very first time for the rural middle-class customer. NEEM brings care directly to people's homes. Our focus is proactive diagnosis and continuous support to the patient. So by spotting health issues early and managing them well, we've been able to cut down on the need for unnecessary tests, expensive medications, and prolonged hospital stays, which, as you know, is where the big bills really start piling up, and that's where people start getting into crushing debt. With this, we've created an innovative service and a lifeline for the rural middle class. And behind the scenes, we developed NEEM 360. This is our tech platform that's like a supercomputer for healthcare. It helps our health workers stay organized and provide continuous care backed by detailed patient record. What makes NEEM unique is that we integrate multiple services for patient convenience right at their own home. We also empower our health workers. They are well-compensated professionals, not volunteers. They are equipped to provide very high-quality care, leveraging technology, to a dedicated group of 150 to 200 subscribers each. All of this is delivered through a very sustainable subscription model. Currently, we have 3 kinds of subscriptions. These are currently priced at Rs 100, 300 or 500 rupees per patient per month, depending on the condition of the patient and whether medicines need to be a part of the subscription or not. So in Satara district alone, we've already touched the lives of around 5,000 subscribers. The changes we are seeing are nothing short of remarkable. We are seeing 50% control rates in diabetes and hypertension among our patients. Now, these are the 2 most crucial risk factors when it comes to conditions like heart attacks and strokes. So this is really incredible numbers. Families are now able to avoid taking on debt for health emergencies, and people are living healthier and more stable lives. We are lucky to be backed by Dvara Holdings and ACT Health, both of whom have been incredible partners and believe in our mission and our impact and our potential for impact as much as we do. Ultimately, if we want India to be an economic powerhouse, we do need private sector solutions like NEEM to complement the public health system to ensure that our people have the ability to stay healthy and productive. Our vision is to become the leading aggregator of healthcare services for India's informal sector. I want to see a future where nobody in India has to ever worry about healthcare costs driving them into poverty.